Hello and welcome to the first in our series of birthdays information videos. Today we have Christen with us. She is our in-house physio and she's going to talk about the first trimester and exercise. This is something that a lot of our mums are anxious about and need a lot of information. So we have Christen here and her expertise. I'm just going to hand over to Christen. Thank you for joining us, Christen, today.
Hi guys, it's great to be on with you tonight. I say this is a great opportunity for me as a pelvic health physiotherapist to come on and get that early education, because as you said, a lot of mums really don't know what to be doing. There's a lot of different beliefs out there with regards to what you should and shouldn't be doing during, with regards to exercise and pregnancy.
So, Christen, that's great. Thank you. Would you be able to give us a quick overview about exercise in the first trimester? So, the first roughly 12 weeks of the pregnancy.
Yeah. So as you say, first trimester is about the first sort of 0 to 12 weeks, and often a lot of mums they mightn't even know they're pregnant until they're sort of halfway through or 3/4 way through the pregnancy. And sometimes that can actually leave them feeling a little bit guilty because they maybe have been doing exercise or, getting on with life as normal. And then they start to panic a little bit as, could that have actually harmed baby? But as pelvic health physios and as research shows, exercise is safe during pregnancy. And we will always encourage all mums to be active as much as possible. The early sort of days as well can be problematic with regards to, that extreme fatigue, nausea and sickness. And these symptoms are obviously barriers to exercise. And often you can find that mums really struggle to get into a routine with exercise. And especially if in trimester 1, they've been quite inactive, it can be hard to pick the exercise back up as they move into trimester 2 and they're starting to feel a bit better. So it's about working with these symptoms as best you can and trying to bring activity into your daily, bring movement into your daily tasks as much as possible. Those sort of symptoms as well, we find, they're the ones that, if you're trying to hide your pregnancy, hide the sickness, the tiredness, that can bring a lot of stress as well. And as I say, can put people off exercising, or if they stop exercise suddenly as well, that can be a sort of giveaway. Or maybe they train as part of a team or, with a group, and suddenly they're like, oh, maybe I shouldn't be doing certain things, and they start to pull back and they're afraid that actually may give away that they're pregnant. With regards to sort of exercise generally, the research shows there are guidelines out there that guide mothers to be and professionals with regards to what you should and shouldn't be doing. Again, there should be a nice mix of strength, flexibility, cardiovascular fitness, and really it's about listening to your body and paying attention to it. And if it feels good, keep doing it, and if it doesn't feel good, we would say stop and seek advice. In the perfect world, we would love that every mother to be is working with a health professional, a bit like ourselves here at Fit Bumps and Beyond, or attending the birthdays workshop, work alongside somebody who is trained with regards to antenatal and postnatal care, and the idea is that then they will guide you, as you move through your different trimesters. But I suppose that the takeaway message is exercise is safe in pregnancy, even if you haven't exercised. We will encourage you to start and build it up gradually. And if you are already exercising, it's a case of keeping it going and modify as you need.
Okay, great. Thank you. And Christen, what would you say would be some of the benefits to mums of exercise and physical activity in pregnancy?
Yeah, I mean, the research shows that exercise improves mum and baby's health. It improves heart and lung function. It can reduce the likes of cardio or constipation. It improves your mood, can improve sleep, just improve your overall confidence. And it also shows that you can reduce the length of your labor and improve your postnatal recovery. But yeah, again, it's just, there's a lot of positives to it, and again, every mother will be different, and it's finding something that works for you, finding activity that makes you feel good. Like, there's no point in going out running or walking if you hate it, or taking up Pilates or taking up a strength class and you're like, I don't want to do this, but the research says it should. So it's about finding something that works for you and makes you feel good at the end of the day.
Great, thank you. And what would you say would be the things that mums would need to consider about exercising in pregnancy?
Yeah, you'll find, again, there's a lot of beliefs and a lot of sort of confusion out there, and advice, sort of Chinese whispers being thrown about by, it could be family, it could be friends, or, other people who have been pregnant, and I did this and she did that. And, every pregnancy is very individual. And again, that's where working with a professional is a great idea, or attending the birthday workshop is a great opportunity to get that early education to sort of help you, start off on the right path. What you want to be considering is, how many pregnancies have you had? Have you had vaginal delivery or C-section? What age are you? Do you have any underlying pelvic health problems? Do you have any, medical issues that will need to be considered while you're pregnant? That could, that would mean you would need to modify or, tweak your exercise to manage those conditions. Obviously, as you're pregnant, you can develop issues like gestational diabetes, and these sorts of things obviously need to be managed as your pregnancy progresses. So again, there's no sort of blanket exercise program that will fit every mum. And as you move through your trimesters and as your body changes, and depending on how you're coping, you'll have to modify and tweak your exercise accordingly. So it really is about being really in tune with your body, and paying attention to how it's responding to the exercise as your pregnancy progresses. We also want to think about your job, your hobbies, your lifestyle, and how does that sort of impact and have a place. How can exercise and physical activity sort of be brought into your daily routine? And it's all about making it as easy as possible. Exercising shouldn't be a chore. As I said previously, it should be something that you enjoy, you feel good, it's benefiting yourself, and it's benefiting baby.
Thank you. And what would be some of your top tips for mums?
So top tips would be attend the birthdays workshop. And really, as I said, it's about being in tune with your body, and, paying attention to it, and listening to it. And as if you are an exerciser, keep exercising, but modify if needed. If you don't exercise, start exercising, but the key is to start off gently and build it up gradually. You may have heard before they talk about don't bump the bump. So activities that, you're maybe more likely to fall over, or the likes of road cycling or gymnastics or horse riding and trampolining, they may not be the most best thing to be doing when you're pregnant. Think about the environment that you're exercising in. Think about, what clothes you're wearing. Are they tight, restrictive? Think about good hydration, plenty of ventilation so that you're not overheating. You should also, there's a quick test, so they talk about the talk test. So when you're exercising, you should be able to maintain a conversation. So that would be sort of moderate intensity. The guidelines recommend that you should be doing 150 minutes a week of moderate intensity exercise. So people will always ask what's moderate, and that's what I'm saying. If you can hold a conversation with somebody while you're exercising, then you're probably around the moderate level. But if you're out of breath, then you're probably overdoing it and need to slow down a little bit. Also just pay attention that if you start to develop any pelvic back pain, any uterine, like pain, or if you thought you were having contractions, or if you start to leak any fluid or any swelling in any limbs, we would obviously advise that you stop and seek help and advice from a health professional before continuing. And obviously do your pelvic floor exercises and make sure to maintain good bladder and bowel care. Avoid constipation and straining, because you don't need any extra pressure on those pelvic floor muscles.
Thank you, Christen, and I'm sure everybody will appreciate expert advice, knowing that you're a trained physiotherapist.
Thank you.
Thank you for joining us today. If you want to know more about what we do, we're on www.birthdays.baby, and join us again soon when we'll have another topic in conversation with Joyce and myself.